Hello and welcome. My name is Brendan O'Neill, and I'm a member of Esri's nonprofit and global organizations team. And together with Olivier Cotre, Esri's Director of Humanitarian Solutions, we will be your hosts for our Humanitarian Community GIS Day webinar. We'll be hearing more from Olivier and our panelists in a moment. But first, I wanted to talk a little bit about GIS Day itself. It's really an international celebration of the individuals who are applying geospatial thinking and technology to make a difference in our society. There are over 1,000, that's right, 1,000 GIS Day activities happening all over the globe today. I may be partial, but I believe we have one of the best, given the inspiring speakers with us. Today, we will be hearing from members of our humanitarian GIS community about how they have used GIS tools to increase their ability to build resilience and respond to humanitarian crises. We will also be hearing from some of our Esri experts who will introduce you to the technology and workflows that you can use to positively impact your own communities. Our presenters are Ms. Nadia Badram from Social Workers Syndicate in Lebanon, Mr. Ali Awad from Esri Lebanon, Ms. Lindsay Thomas from Esri, Mr. Qasim Shalan from the Lebanese Red Cross, Ms. Rahima Nakibuka from Resilience Mappers, Dr. Erica Nelson from the Harvard Humanitarian Initiative, and Mr. Rami Alauda from Esri. And they'll be introducing themselves in a little more detail throughout their individual presentations. So with that, I'd like to turn it over to Esri's Director of Humanitarian Solutions, Olivier Cotre, who's going to introduce you to our brand new Humanitarian GIS Hub, as well as our panelists. I'll be seeing you a bit later in the question and answers. So take it away, Olivier.
Thanks, Brendan, and good morning, afternoon, evening, everyone. My name is Olivier Cotre, as Brendan mentioned. I'm the Director of Humanitarian Solutions at Esri. So today, yes, we'll be having the pleasure of hearing some great stories from our speakers. We'll be doing things a little bit differently. We'll be hearing these stories as we make our way through the Humanitarian GIS Hub. So this is also an opportunity for us to present this new hub to you. So I will kick off by providing a bit of background to the hub, why and how we developed it. We'll then have a very quick tour of the hub, and we'll be weaving our presenters in and out of this tour as their stories appear on the hub. So first off, a bit of context. I'm part of a team at Esri called Industry Solutions, which basically acts as a liaison between Esri and a particular sector of work and provides a strategic cap on the support we provide that sector. So in our case, between Esri and the humanitarian sector. So our role is essentially to help Esri navigate the humanitarian sector and help the humanitarian sector navigate Esri, and ultimately with the goal to ensure that the sector derives maximum impact from GIS. Now, we're all here, I'm assuming, because we believe fundamentally in the potential of GIS to improve humanitarian action and outcomes. We understand the importance of geography and place and contextual knowledge for successful operations. And we're also seeing more and more the recognition of the organization-wide improvement that GIS systems can provide. And I insist on the term systems here. So going beyond GIS as a map making tool to GIS as a system in the true sense of the word. So a system of record, a system of insight, and a system of engagement. And this is the system of engagement is in a way what really distinguishes GIS from other analytical tools in their sort of cartographic visual language that they provide. Now, our field of work has grown enormously over the last 20 years from just a handful of organizations applying GIS to humanitarian work in the early 2000s. GIS is now present in literally hundreds, if not thousands, of humanitarian organizations worldwide. Esri's nonprofit program, for example, has grown tenfold between 2015 and today, for example. Esri's disaster response program has also seen an exponential increase in the number of requests. Because of COVID, the number of requests in 2020 alone surpassed the total number of requests over its 16-year existence. But this expansion has been very organic, and it can be hard to get a sense of structure in this very rapidly evolving field of practice. We're often quite opportunistic in catching technological innovations on the fly and kind of seeing if they stick. We also spend a lot of time and energy wading through a huge amount of potential solutions to our particular problem. Most of those turn out to be irrelevant or not suited. They're very appealing. There's lots of nice tech, but they're not necessarily much use before we manage to finally find what we're actually looking for. So I'm hoping we can start addressing this by collectively, as a humanitarian GIS community, creating a sort of science of humanitarian GIS, so to speak. And you'll actually hear more on this from Erica later on today. So a framework that allows individual GIS practitioners or organizations to more clearly identify how their particular needs fit within a categorization of humanitarian use cases, how that maps to specific technological and methodological solutions. Who has done similar work? What are the best practices for my particular use cases? What technologies and solutions are available to me for these, and how do I apply them? All those questions are really quite difficult to answer right now, and I think this leads to much slower progress and impact than we could otherwise achieve with a more structured and deliberate learning process. And so that's essentially what the hub is meant to help tackle, to facilitate more efficient discovery, implementation, and improvement of solutions and good practice. Now, the initiative of a Humanitarian GIS Hub actually started a couple of years ago, back at the Humanitarian Network Partnership Week of 2019, as we conducted a number of consultations with several organizations that were present to really understand better what would be expected of such a hub. And so it's with that information that we really started working on this. So first of all, we start by cataloging and taking stock of what we have against this sort of defined humanitarian ontology of use cases, a sort of language of humanitarian GIS, if you like. Then as a sort of second step to the hub, second phase, we can imagine then exchanging on implementation good practice of these resources. And once we know what we have, excuse me, I just went a little too fast. Once we know what we have and what works against our use cases, we also know better what we don't have and what doesn't work. So we're then better able to target our efforts in building out more and better solutions. So very quickly, just to point out that the hub is essentially structured, as you see, this is just a schematic of the structure of the hub. I won't spend too much time going into details. We'll be exploring the hub over the course of this session now, but this is just to illustrate the variety of branches that we've already identified in this first pass at a humanitarian ontology. And no doubt it'll evolve as we work with it. So let's jump right in. So this is the Humanitarian Hub. It's live online. You can go and explore it. The first thing to point out is this little, you'll see the first time you join, it actually says follow rather than unfollow. This allows you to register as a community member of the hub so that you can receive notifications for any updates. You can also explore the hub without following. All of those resources there are accessible publicly, but if you want to be following this and be notified. Now, the hub, as you probably might have seen on the schematic, is built around two large sections. The first banner here is around exploring resources. So these are resources behind these cards that you can access now, today. These are things that you can download and use or look at, explore. And the second big section is built around these longer term initiatives. We call them initiatives, so longer term projects and programs that serve to support objectives, humanitarian objectives that we've defined. So around localization, for example. By that I mean decentralization of humanitarian response capacity, not localization with a GPS, but so this localization drive in the humanitarian sector that we've seen in the Grand Bargain commitments. Initiatives around prevention and anticipation. Prevention is better than cure. initiatives around geographic thinking. So they're really improving geospatial literacy across the humanitarian sector. Initiatives around shortening the loop in innovation from aspirational tools to operational tools by taking a much more demand-driven approach. And then a fifth one I've just added, which is actually empty right now, called GIS for Peace, looking at how GIS can really support peace processes. So we're going to jump in to the hub. We will explore this first card here, which is aimed not so much at GIS practitioners, but managers, operations managers, program managers who want to know a bit better what GIS can do for their organization. So we're calling these some inspirational resources. And so if you click on this card here, you get to this gallery of resources, and as you can see, it's quite a few resources there. And again, you don't want to be wading through these resources, so you have access to these different categorizations. And so, for example, if you're interested in use cases under the disaster risk reduction cycle, which we've gone and defined here, and let's say that we're specifically interested in stories around registering and coordinating responders, you can click on there. And then if you happen to be part of the child protection cluster, click on there, and as you can see, it sort of filters it down to resources that are much more targeted at where you're coming from. Now, just to point out, we're still in the process of populating the hub. There are still many resources to be put on there, but this is not just us populating it. Below each of the galleries that you'll see, there is a Survey 123 form, which allows you to submit resources yourself. You can categorize them according to the ontology that's on there, and you just fill out the form. It's pretty straightforward. Submit it, and then there is a validation process. Since it's public facing, we don't want just anybody to put things there. But once it's validated, it then appears as a card on here. When it appears as a card, you can explore the information behind it, all of the other use cases that this particular resource is relevant to. And then if you click on the hyperlink there, it actually brings you over to the resource itself for you to explore or read. Now, here specifically to talk to us about this particular story is Nadia Badran, president of the Lebanese Syndicate of Social Workers. So Nadia, I'm going to hand over to you to tell us the story.
Thank you a lot. So first of all, I would like to thank Esri Lebanon, especially Greta Kelsey and Ali Awad, for all their support and all their orientation during all this work that I will be talking about now. And the social workers, of course, that there will help us into reaching out to the community during COVID-19 crisis until now. Especially, I would like to thank Silvana Shleila and Daniel Lahoud, and also one of all the social workers who use the system as well, Dania Abi Haidar. So I will talk about the call for action against COVID-19, the experience of the social worker syndicate in Lebanon, and Ali will help me into in doing the slides. So next, Ali. So to talk about a little bit the social worker syndicate in Lebanon, the social worker vision, it's we work towards distinguishable social profession for humanity in Lebanon, and our mission as well is to try in all our work to protect the beneficiaries and the social workers themselves through building expert and promoting our profession. We of course work into to respect a series of values and principles, and these values and the principles are our they helped us into all our achievement. And this what you are seeing now, it's a group of social workers working during the crisis to respond to the need to affected groups and infected by COVID-19. Next, please, Ali. As you know that the epidemic start everywhere in February, and in March 2020 the situation in Lebanon got worse, and we got the official lockdown. And during this official lockdown we were requested from the ministry, from the higher from the Lebanese government to support into doing an assessment of the situation on families and individuals affected by COVID-19. And why is that? To take the decision, we as social workers, if this person can stay at home or have to go to quarantine or to a community center. And here you can see the group of the social workers who were motivated all over Lebanon. There were like 352 field workers, social workers, with 22 other social workers who have been involved in the coordinating of this activity. And you can see they were distributed all over Lebanon. And why this? We were requested to develop or to form crisis cell, and this is what we did throughout the municipalities. So this is what we did throughout all the municipalities. Next, please. What we were where we were witnessing, if I can say, that the discrimination was happening a lot towards people who have COVID-19. This is why the social workers were not only approaching people, assessing their needs and referring them, but also we did a lot of information communication material. We developed them. We developed some video. One of them, this one, it's to stop bullying and stop bullying against COVID-19 infected people, but rather you have to be more safe and apply the safety measures, not to bully others. And what we did is that we, in our action, we reached out to many cases, among them girls, boys, family members, etc. We did a lot of awareness raising sessions, and we referred people to go to isolated centers. Next, please. One of our programs that is still until now, it is to promote the well-being for boys, girls, and caregivers. What we are doing is we are reaching out to family online, and we are conducting 6 to 7 sessions online to tackle their fear, their guilt, their stigma, the sadness they are facing due to COVID-19. And we are responding to the needs, referring people to other available services. And this is how, when we use the Esri system, we could show our cases, how are the number of caregivers, number of boys and girls, as you see, and the phone calls that we were to reach out to these groups. Next. And you can see when the situation was better, we reached out in person and we went to the field to reach out to the children and to do the awareness session live, and also to distribute some kits to the door-to-door to the families. And all this work was in the support of 52 social workers distributed all over Lebanon, and we reached out to almost 800 municipalities into Lebanon. We developed a lot of material. You may see here videos, and before that there was another video as well. Next, please. And what we did also, we did an assessment, a crisis assessment, and with the help of Esri team, we developed this assessment where we could identify the problems, the critical problems that the people are facing, their feeling, their emotion, and we referred them to the available services in their community. Next. And we reached out, as you will see here, 14,000 family members and 3,268 family members all over Lebanon, distributed, as you see. And when we extracted the data, you saw these data, how many people were in need of psychosocial support, other kind of support services. Next. This was the family assessment dashboard, and here you go, you will see one of our beneficiary who was very satisfied from the session that were conducted online, and he was thanking the social workers. So and also the post-COVID-19 family assessment, what we did is that we took a sample from all the families that we reached out. These family members, we reached out again to them, and we analyzed the data, and this was very useful for us to have data and to showcases and the imminent needs of the people. So this was also with an opportunity given from Esri platform. Here you can see some data from this assessment, and we can go to the next slide. Ali, when we can see the vaccination, when the Ministry of Health asked all the organization to be involved in promoting the request for vaccination. This is what we did. We developed a small questionnaire distributed all over Lebanon for all the social workers, and we got like almost 270 questionnaire where the social workers said if they want to be if they want to be vaccinated, yes or no, and where they live, because this was also an important information to know about. So, and what we will be doing next with Esri, because it was very useful platform for us and very innovative as well. For the upcoming, we will be developing the social worker syndicate Lebanon database with the members, and also with non-members and volunteer, and this will be very important for us to identify our member all over Lebanon and to see how we can promote our work in the future. So I think this is our story, and it will end here. And I think with what we end here, we will start again the work with Esri, because it was very useful, as I mentioned. So thank you again for this opportunity, and for the Esri Lebanon, Greta, Kelsey, and Ali. Thank you.
Thank you so much, Nadia, and congratulations on really a fantastic project. Really amazing use there of the technology and very integrated system approach there. It's really, really nice. Okay, well, thanks very much for that story. We will now continue our tour of the hub. We'll move on from the inspirational cards to the cards that contain solutions, more solutions and learning tracks and resources that are aimed at GIS professionals who want to solve a particular problem, who have a particular problem in mind and need to figure out how they can go about doing that. So same principle. If you click on that card, you end up in this tab here on this gallery, which I've already pre-filtered for you this time. You get the same idea. You get a few other categories there that you can be filtering by. So we had the disaster risk reduction use cases from before, clusters and programs. This time we also have use cases around specific spatial analytics questions that you might be asking yourself or trying to address, questions around information management phases, from data collection all the way through to reporting and engagement. Questions or categories around technology, if you're needing to apply a particular or want to know how you can apply a particular technology to a disaster risk reduction use case. And then also resource type, which basically distinguishes between a solution that you can configure and deploy onto your system and training or how-to documentation. So if we click on this resource here, for example, you end up, this is a solution, one of those deployable solutions that you can deploy onto your ArcGIS Online environment. And here to speak to us about this particular solution, but also ArcGIS solutions in general, is Lindsay Thomas, our Public Safety Solutions Lead at Esri. Lindsay, over to you.
Thanks, Olivier. So Olivier showed you how to get that on the hub, but I'm going to talk a little bit about what are ArcGIS solutions. And so solutions are actually part of the ArcGIS that you already have. ArcGIS includes a series of these ArcGIS solutions that help transform your use of ArcGIS and are aligned with your business needs. They also are going to help you maximize the investment that you've made in location-based data and technology. They're industry-specific configurations of ArcGIS, and they're designed to help improve your operations, provide new insight to your data, and enhance the services you're providing to your organizations. So solutions come with your software. They're also supported by Esri support services. So if you need help, you can call and get some help. And you can deploy these within minutes. So you can quickly stand up maps and apps and solutions really quickly within your ArcGIS Online organization or within ArcGIS Enterprise on your own infrastructure behind your firewall. Now we support many domains, as you can see here: health and human services, local and state government, provincial government, defense and security, and of course, emergency management and public safety. We don't specifically say we support the humanitarian community, but we all know that humanitarian community often fills gaps that governments can't meet or fill additional gaps in the work that they do. So in many cases, you're going to be able to use these solutions one-to-one. It's going to fulfill your needs. But in some cases, you may want to use it as an example or a pattern that you can follow, and then do additional configuration of those solutions to really dial in that workflow and use case and the problem that you're trying to solve. So now that we've talked a little bit about what a solution is, I want to show you one. So one of our more popular solutions is emergency management operations. You can see right here. And this solution is used to help manage incident operations, maintain situational awareness during an emergency response or recovery. So that could be, and that could be used in crisis management or within an operations center. And this solution is typically deployed by emergency management agencies when dealing with a response or recovery event. And so these maps and apps all work together as part of one. Collectively as a solution, it has a variety of maps and apps that all work in concert together. And the first one that's part of this solution is Situational Awareness Viewer. This helps you understand the potential impact to human populations. You can see we have a total population and vulnerable population here, all within this incident area. It also lets us know the potential infrastructure impacts during an event. The complementary app Operations Response helps you understand the status of emergency facilities and response teams. It allows you to update your data real time with new information that's coming into your operations center or wherever you're running your operations from. So you can add additional incidents, allocate points of distribution, food distribution centers, first aid centers, as well as add any roadblocks, evacuation routes, or evacuation notices, and update all those. And as you update those, that's getting updated across all the applications and maps that are part of the solution. So on the incident status dashboard, you can imagine this running on a big screen in an operations center or crisis management center. And this allows people to get active, real-time understanding of what's happening during this event, whether that's shelter, weather warnings, road closures, and really understand that and be able to measure progress in real time. We also have the incident briefing app that can be used to visualize and brief key stakeholders at different intervals to understand what happened and what's happening. And finally, we have the Emergency Response Hub that is the authoritative source for information during an event. This will give you up-to-date information on road closures, evac notices, and shelters that are available. It can provide information on evacuation notices, whether that's mandatory or voluntary. You can configure this to point to additional applications or information about finding open shelters, soliciting volunteers, and you can configure the newsroom to look at authoritative information that's coming in that you want the public and media to be looking at and kind of help combat misinformation that often happens during an event. And finally, you can configure the frequently asked questions. So that's the emergency management solution, or at least part of it. This is one solution with many interconnected maps and apps that help you maintain that situational awareness. But how do you get started in your organization? So this is great. So if you come back to the hub, and this is the way you're accessing it, if you click on the emergency management operations here, or damage assessment, or any of the other solutions, it'll take you to our ArcGIS solutions site. You'll get some information on what the solution does. You can look at the requirements, the maps and apps available, and any additional updates that we've made. But if you come to this Deploy Now section and click on this, it'll launch our ArcGIS Solutions app, which is part of ArcGIS Online. And you can see all the different maps and apps that are available and solutions here. And you can, if I filter this down, you can see that we have over 100 if we look at this across different sectors. And if we go into emergency management, we can see all the solutions available here. So if I go ahead and click on emergency management operations, what that's going to do is deploy that solution. I pre-deployed it, but basically you'll come to this My Solutions tab. You'll see emergency management operations. And when I open that in my organization, I'll have a folder and all the content. So all the maps, apps, layers, and components of those solutions ready to go and ready to work together. And what the next step would be, go back to the documentation, and we will talk you through how to load data, configure those maps and apps to make adjustments as you want to fit your organization's needs, and then you're ready to go. And once you've actually gone through that process, if you look at the use section of your documentation, this is really the user manual for using all those applications. So we talk about how to assess impact on those vulnerable populations, how to define an incident area, brief your stakeholders, visualize incident status. So it takes you through how to use all those maps and apps here. So I want to show another shortcut to get to this. If you're logged into your ArcGIS Online organizational account and you come over here to your app switcher, if you click on the purple suitcase, you'll go to ArcGIS Solutions, and that'll launch this app. And that'll allow you to search for things that you're interested in by keyword, or filter by different types of domains. And I would encourage you to take a look at this and see if there's solutions already available that suit your organizational needs to help you get quickly up and running, whether that's using it one-to-one or using it as a useful pattern to help you in the workflows that you're trying to support. And with that, I'll throw it back to you, Olivier, and take any questions if we have time.
Thanks very much, Lindsay. Thanks very much for this tour of the solutions. We will take questions towards the end of this session, actually, and I'd like to remind participants to please, if you've got any questions, put them into the chat. We'll compile those and address them as we can towards the end of the session. Anything that we're not able to address at the end of the session, we will address by email. We will definitely get back to you. So if you've got any questions or comments or suggestions, in fact, please don't hesitate to drop those into the chat. We will continue our tour of the hub, and so the third and final card of resources that we have here is our resources that are stood up either by Esri or by third-party entities to support specific operational responses. So if we click on that card, we get to another one of those galleries, except that this time these are resources that you can use and deploy, or rather services, let's say, that you can use to support your particular operation. Once again, a number of different categorizations here, including also, by the way, categories around glide number, if there are resources there that were built for specific operations that have a glide number. Otherwise, you can also filter by event type. So let's say that we're interested in resources for epidemics, big topic at the moment, and continue sort of filtering down as you go along. You get the idea. I won't spend too much time doing that. Just to remind you again that there is at the bottom of every one of these galleries a form for you to submit and suggest resources that you think should be on there. In this particular case, we've just filtered down to epidemic. We see here, for example, a resource called the Lebanese Red Cross COVID response. And here to speak to us about that is Mr. Kasim Shalan, of the Disaster Risk Reduction Director at the Lebanese Red Cross. So Kasim, please take it away and tell us this story.
Thank you, Olivier, and thank you for all the presenters and taking, from where you end by presenting and by launching the hub by Esri. Now we're taking this opportunity as well to launch the hub by the Lebanese Red Cross, and here we would like really to thank Esri Lebanon on supporting our team to do that and by building their capacity to be able to do that by themselves. So from where this idea came from, as you know, COVID-19, we have a big problem started in February 2020 in the country. The Lebanese Red Cross start to support the community through something we call it the community engagement, and to start to build the capacity for the local initiative. And from here, we started from Sunday framework to making sure that the community have access to information and they are able to respond by themselves. During that time, and in coordination with the DRM at the Council of the Ministry of Interior and Municipality, Ministry of Public Health, we were able to provide community contingency plan for almost 875 municipalities or local authorities. During that time, and in order to run any response, you need to have access to information. We found out there's a lot of duplications, poor access to information. By providing the community contingency plan, the local authority are not able to have access to the local and international NGO that they are able to give this support. Based on that, we found out that the hub can really solve this problem. We start with the COVID info and maps, but the community can have access to all of the emergency hotline, vaccine registrations, hospital admission, in addition to the free hotline that the patient can have access to a call and receive consultation, and at the same time how they can receive access to the oxygen machine. In addition, for the governmental vaccine registration platform for the Lebanese and non-Lebanese residents, people who are eligible for vaccine, people eligible for the walk-in vaccine. Here we use the web map where we generated with a nearby option to search by location, address, and the nearest hospital for a different type of vaccine. Live indicators present the total number of cumulative cases of deaths in Lebanon. And here, what we are presenting now about COVID-19 hub, it will not be limited only to the COVID-19, only if it's like, access to all of the health facilities. In order to help the community to take decision, we use a web app, dashboard, and web map were generated to show. One of them is the incident rate. The incident rate, this is have access to all of the community. You can filter it per governorate or per Gaza or per village. By doing that, you can see at the big map where it's showing the red point, and here it's like red flag where the local authorities and the authority, they should take actions about it. With all the relevant and important information related to this village. In addition, you can see the analysis per governorate, and the next one, it's the analysis per Gaza. The second map is showing the COVID cases number, where you can see it per governorate. Then you can zoom in, you see it by district, and you can zoom in more, and you can see it per communities, in addition to all the relevant information required. Third map is the heat map, where it's showing exactly the red point where you have more incident, and it's gonna alert the community. All these 3 maps, it's in coordination with the Ministry of Public Health, where they provide us daily with all the information, and again, it's shared with the public. We have the other ones. The web app were developed for citizens to access the nearby PCR testing location, and we are always making sure through the relevant ministry to keep updating this information. Again, when it comes to the awareness session, we always make sure that the community have access to all of the awareness tools, videos, flyers, posters, and at the end they can receive certificate, and by keeping them updated with all the relevant information. In addition to the frequent asked question, it will take you to the Ministry of Public Health page, where you can really keep updated with the frequent asked questions. The other part is again related to the vaccine awareness, latest vaccine information, and the video provided by the Red Cross and by the Ministry of Public Health. Other information, general information about COVID, about the hygiene part, about the isolation, about if you feel unwell, how you can deal with. Open data set. This is a web app with interactive legend, as you can see. As you can see, showing the medical facilities like hospitals, lab, dispensaries all over the country, and the service area of hospitals within 10 minutes driving distance. The analysis was done through the ArcGIS with the ArcGIS Pro software. This helped us to define the community with the limited access to the health facilities. The other important part for us, and that can help the community a lot, is the mapping for the NGOs and the local initiative. And that again, you can filter it per the NGO type or NGO name, or even you can go to the service type that the NGO do. That will help the community to have access to the information. Second, that will help a lot the local authorities to plan their response plan. Third, will help even the plan for the NGO, national and international, to avoid duplication, to do linkages, to have a complementary approach among them, and that we can make sure that they can spend their fund in the best possible way, and we can advocate for a collaboration. Because at the end, in order to achieve community resilience, it's through collaboration, and it's everyone's business, and we are trying to help everyone to reach this information. In addition to the last part is the service area per village, and here can help the local authorities and even the governor. You can filter it per governorate, district, and village, and by doing that, it will give you the zone of your zone of intervention. For example, here it's showing that in this area we have 28 NGOs working with their full information with a type of intervention. So, and the last part is related to the community, how they can request support. They can ask us online by requesting oxygen cylinders or oxygen machine, or even if they have interest to donate blood. So for us, this is the start. This is the launching. Now the aim to deal with the hub for the multi-hazard approach, making sure the community have access to this information. So hopefully by on the next year, we'll be presenting the update on the hub. Thank you, everyone.
Thank you so much. Really fantastic story and demonstration there, Kasim. Thank you very, very much for this. All right, then we continue our tour. We've now covered all of the cards and resources that are immediately available and accessible for you. We're going to start to explore a little bit some of the longer term initiatives that are contained on the hub here. We're going to start with localization. So if you click on the localization tab here, it takes you to another page on the hub, which basically contains a number of programs and partners and organizations that work towards this issue of localization, this issue of decentralizing humanitarian response capacity. And another thing that you find here are two geoportals. We're sort of building out these regional geoportals. So you see the Africa geoportal here and the Caribbean geoportal here. If you click on the Africa geoportal, you're then brought to a number of resources that are specific to Africa, that are building up a community of practice in Africa, and you'll find, again, a number of inspirational stories about community mapping projects, including, for example, this project here by Resilience Mappers on health and education in Kawempe informal settlements in Kampala. Here to speak to us about that and tell us the story that she and her team have been working on is Rahima Nakibuka, co-founder of Resilience Mappers. Rahima, over to you.
Thanks, Olivier. Hi, everyone. My name is Rahima Nakibuka, just like Olivier said. Now, as far as health and education and sanitation is concerned, it is the citizens that stay in informal settlements of these cities that are more prone to related hazards. Now, the number of informal settlements in Kampala that are devoid to core services or do not have sufficient services, and this would be one of the leading causes of the poor living conditions in these areas. Now, building resilience and sustainability in these areas starts with availing spatial data, and our community resilience mappers recognizes the need to provide spatial data in these communities. Now, this project was focused on collecting health facilities, education facilities, and waste dump sites through 11 informal settlements of Kawempe. Now, to mention, Kawempe is one of the divisions in Kampala that has over 15 informal settlements, and we started with this one. Now, our community focuses on the community itself as well as the youth that are in this community. So we engage and work with community members as well as OSM communities, youth mappers communities, and local working groups for girls and women. So in this particular project, we trained over 25 volunteer mappers from those communities that I mentioned, including youth mappers, local working groups for girls and women, like I mentioned. Now we like to think about it as a way of engaging the community because they understand their communities, as well as get to understand the importance of community mapping and GIS, what GIS solutions can bring, what solutions GIS can bring to their society. So we trained and we trained them in field mapping tools. For this particular one, we used the Open Data Kit for field data collection, as well as the OSM and for navigation through the entire settlements for to ensure extensive coverage, as well as learn to use these tools themselves. Now, just like I mentioned, we mapped health facilities, education facilities, and waste dump sites. But this particular project was an appendage of a field mapping activity we had in October 2020, where we mapped out all the roads and buildings in these 15 settlements. So it is, when we share this data with other data users, they identified the need to map the core services in these settlements. Now, with the data we collected, it included the locations of the health facilities, education, and all the facilities we collected, the operators, the contact information. Now, for health facility included the emergency services, if they're available, the bed capacity, the availability of incinerators, how many doctors or nurses are in these settlements, these facilities, as well as the toilets, the accessibility to the toilets and water. Now we populated this data in a web map that is freely accessible and has all the information that we collected, all the attributions we collected. So one can just navigate the web map and see all the attributions of a facility, like the number of doctors, nurses, if they have toilets, water, as well as the contact information. So we did this for all the facilities we collected, the health and the education, as well as the dump site. Now the dump site included if it's a legal dump site or illegal dump site, so that at the end of the day, the authorities can know where exactly the waste dump sites are, or if at the end of the day, the rubbish collectors know if this rubbish pit is known that we collect from here rubbish, or it is just an illegal dump site somewhere in the corner of the village. Now we also populated our dashboard that allows us to query for the data more specifically. So right now, if I'm navigating through this dashboard, I can look for example, the health facilities in a particular facility, settlement, as well as see the statistics of the facilities in these settlements. Now this also allows you to see the attributions of the facilities in this settlement. So it's a dashboard as well as a web map. So it allows us to, it's like a repository that we keep putting our data from the series of data the data collection activities we've had over the time. Yes, so now we also have these static maps that we developed, and we use the minimal gallery in the Africa GeoPortal, just like Olivia mentioned, that allows you to publicize your static maps. Usually static maps are on your desktop, maybe in a corner somewhere on your drive. So this tool allowed us to share our static maps, that for anyone who cannot use the online tools very often, they can as well go ahead and download the static maps, which may not have all the information like the web maps, but at least it's a static map that someone can use at convenience. Now, with all this data that we collected, we had share back meetings with our data users, ArcTogether, one of the authorities or organizations that work and deal with informal settlements, and the local leaders in these settlements, and they identify that these maps will be used to identify potential treatment centers, evacuation sites in cases of pandemics, like we've been fighting the COVID-19 pandemic, as well as advocate for such services in these areas during their meetings, authoritative meetings with the big authorities. They can use these maps to advocate for services where they are not sufficient. They also can use these maps to make informed decisions about for their villages, what they need, where to put it, as well as clean up their villages for the waste dump sites that are not known of, or they can as well tell the garbage collectors of those dump sites, so that maybe through their navigation schedules, they can maybe collect the rubbish. Now, if the local leaders and the authorities that have intervention programs in these communities can use our map products or can use our spatial data, we like to think about it as a good step to building sustainability in these communities or villages. I would also like to thank Esri community and the OpenStreetMap team, the humanitarian OpenStreetMap team, for supporting us. Thank you. And I'll take it back to Olivia.
Thank you so much, Rahima. I find that such a nice example of community mapping, and not just the collection of information, but also, again, with a very sort of clear use case in mind, and a set of solutions that you want to be developing for that community, so that they can actually leverage the data themselves. So a really nice example of this term of localization, and really putting GIS and geospatial capabilities in the hands of local communities or national entities. So really, thank you very much, and congratulations for that work. We will continue our tour. This time we're going to go over to the geographic thinking and geospatial strategies container here on the hub. This one contains resources that help develop the concept of geospatial analysis. There's a number of resources there that you can go and explore. I'd recommend, for example, The Language of Spatial Analysis, which is a really nice exercise book, actually, an ebook that allows you to recategorize spatial analysis questions, and you actually find that categorization in the different galleries that you see and under the spatial analytics. So it really breaks down spatial analytics into these categories. They're very clear categories. Now we're very pleased to be teaming up with the Harvard Humanitarian Initiative's Humanitarian Geoanalytics Research and Education Program, HUMGEO. And together we're going to be working and engaging with the community to develop this notion of science of humanitarian GIS. And here to tell us more about it is Dr. Erica Nelson, Program Director at HUMGEO. Erica, over to you.
Hello, everyone. My name is Erica Nelson, and I am very honored today to speak to some of the work that we're doing at the Humanitarian Geoanalytics Program at the Harvard Humanitarian Initiative with my co-director, Greg Greeno, who couldn't be here today. Today, I'll be talking about building the science, leveraging geospatial thinking in humanitarian research and programming. So as everybody here knows, humanitarian crises are very stochastic processes that demand a multidisciplinary approach to even begin to make any version of an effective or ethical impact. It requires data and conceptual lenses from diverse sciences, and geoanalytics is the ideal methodology to synthesize these ontologies and data. At HUMGEO, being the spatial nerds that we are, we do just that. We draw from a plethora of disciplines and methods, harnessing geospatial thinking and spatial methods to produce a range of products from research to education to programmatic recommendations. We do this through leveraging spatial analysis. This is a methodology that goes beyond mapping, that uses inferential statistics to create new answers through spatial thinking, build a new academic base for the humanitarian research and response community, and most importantly, optimize impact through a spatially explicit understanding of needs and resource deployment. We have multiple mechanisms of action. We do a lot of research, obviously. We also produce a lot of educational products, both at Harvard, but also for the international and humanitarian communities. And for those organizations that do not necessarily have or have limited GIS capacity, we provide consultancy products. Now, as Olivier noted, and can be seen on our story map on the Humanitarian Hub, we engage with a diverse number of projects across the humanitarian landscape. Everything from looking at environmental impact of refugee influx to atrocity prevention, early warning, and early action. And today I'm going to dig into one of those projects to example our specific method of building the science of humanitarian geoanalytics by merging our academic ontologies and programmatic insights, wisdom, and priorities. So this project we did in collaboration with our colleagues at the IOM in the Eastern Horn of Africa. And the goal here was to really dig into some of the relationships between climate and migration. Now, what you're looking at here is actually a basic framework for how we choose to go about building the science of humanitarian geoanalytics. We feel that given the fact that our objective as scientists is to create impact, it is beholden upon us to start with the end user of our work. We have to start with collaboration. This allows us to define the problem and objective and priorities of the community that we're working with or the organization that is trying to enact change. We take those problems and objectives and define the question that potentially spatial analytics could explore. We examine what's been done either within the organization, but also within the academic and programmatic communities. We then go on to explore the data, whether it be a secondary analysis like this project where they already had FMR data, or we think about the types of data that need to be collected and the scales thereof. We then dig into our spatial toolkits and develop some methods that might be able to address some of these questions. We pilot those methods, we evaluate those methods in collaboration with our programmatic partners, and then in an iterative process, we redesign, we repilot, we reevaluate, and oftentimes we do this multiple times. And then, of course, we disseminate. So for this project, there were really protracted conversations before the inception of any sort of spatial methods to really identify the priorities of the IOM in the Eastern Horn of Africa, to really understand the scale of the work they wanted us to engage in and the scale of the data that speaks to that, and then also to think about the decisional thresholds of that organization. What degrees of change do they need to see in order for that to impact their decision making? Now, with any collaboration, there needs to be shared conceptual models, and sometimes this may require some fostering of spatial literacy. We do this with a lot of our collaborators. The first step, of course, is to understand what their a priori understanding of spatial data, spatial methods, spatial analytics is. And then oftentimes it involves a little bit of education around moving from maps and spatial representations into this really statistically rigorous process of spatial analytics that may range from cluster analysis to spatial vulnerability modeling to spatial optimization algorithms. After those protracted conversations, we came up with some of these objectives for the project that led to identification of 3 predominant questions. The first is, from where are people migrating in this space over time and space? Why are they migrating? What are the drivers of migration, be they economic, natural disasters, seasonal migration, and how are those drivers of migration changing over the time and space that we're interested in? And then what is the relationship with climate change, between climate change, environmental variables, and outmigration? We looked at what had been done. This was predominantly descriptive statistics, both in tabular and map format. We explored the data, specifically the FMR data, and then we also had to reach out and identify open source data with regards to environmental variables like ground temperature and precipitation rates. And then we looked to develop some methods. We identified 3 different spatial methods that could address these 3 different questions. The first was cluster analysis trends, the second was time-space analysis, and the third was geographically weighted regression. Again, this required some iterative processes with input from our collaborators, but in this slide, we can see some of the spatial products we produced. This is a Moran's Eye cluster analysis that highlights clusters and outliers of migration trends historically across the region that had yet to be identified. These could certainly provide some insights for future funding and programmatic priorities. This is a time-space analysis, 2 of the products from that, looking at how the different drivers of migration varied across time and space. And you can see some very interesting trends when you're comparing economic-driven outmigration versus natural disaster-driven outmigration. Lastly, we have the results of our GWR, which looks at migration and climate and those open source variables that we brought in for other spaces. We can see how on the left-hand side, outmigration is disparately or heterogeneously correlated to temperature across the region in January through March of 2018. And these trends can, let's say, begin to embolden our understanding of how these different environmental variables and ultimately climate change can interact with migration. Ultimately, we created a report that combined contextual data with our spatial analysis to begin to explain novel trends that were revealed. And while spatial analysis is not the panacea for addressing the complexities of migration or humanitarian crises writ large, through building the science in collaboration with our humanitarian colleagues, we have begun to increase the understanding of needs through identifying previously unnoticed trends, and have begun to change the way people can think about targeting their resources and identifying their priorities. And with that, I want to thank you, and I'm going to hand it back over to Olivier.
Thanks so much, Erica. Really interesting stuff here. So we are nearing the end of our tour here, and we'll be hearing from one last speaker, especially, well, it'll be Rami Aluta, our colleague from Esri, who will be speaking to us around some innovative technology. So if we dive into the innovation initiative here on the hub, once again, you see the same kind of format, a few resources there that feature some of the upcoming technologies and a gallery, once again, that allows you to cross, this time, these different technologies with different disaster risk reduction use cases. And Rami was involved recently in a bit of an internal competition to really apply some innovative spatial analysis to some humanitarian use cases. And this right here is the story map that resulted from it. So I'm going to hand over to Rami for us to walk us through. Rami, that's all yours.
Thank you, Olivia. Hello, everyone. This is Rami Aluta, and I'm a solutions engineer working out of the Rotterdam's office. Today, I'm going to be presenting to you our story on the Rohingya refugee camp analysis. I'm pretty sure most of you are familiar with what's happening in the Rohingya camp and the refugee crisis that are there. And what we're trying to do today is get to utilize spatial analysis to touch base on the SDG 6, which includes ensuring the availability and sustainability management of water and sanitation. Through this story map, we will be going through different spatial analysis processes that we've done in order to touch the core of the SDG 6. Our study area starts in Bangladesh, and that's in Myanmar, between the region of Myanmar and Bangladesh. And just give me a second. So I'll get back to this. Yep. So our area of interest is in a region called Cox's Bazar, where the majority of the Rohingya refugees sit, and it's at the borderlines of Myanmar. For our project, we decided to work on a small area of interest for the availability of data and in order to get to the results fast. Our analysis mainly touched 3 different questions that we wanted to answer, and these questions was: what % of population within our area of interest lives in the most critical areas of flooding? How many washrooms and latrines are located within these areas of flooding? And what % of refugee camps do not have access to washrooms within a 2.5-minute walk? The answers for this, and we'll get to know through the process how we got these answers. There's approximately 27% of the population living in areas of flooding. There's almost 100 latrines and 45 washrooms within these areas. And as we can see within this dashboard, our mainly flooded area is sitting in here, and we can see the tents that are at the risk of flood. This is really a bad situation because with flooding, a lot of issues might be created from them, as the loss of these latrines, which sit in the same area, and the washrooms. And we've utilized the dashboard in order to visualize this. Now, for the second question is, from this population, how many don't have access to washrooms within a 2.5-minute walk? So imagine you have already to walk 2.5 minutes to get to a washroom. Well, out of this distance, there's approximately 12,000 people from a study area of 32,000 people that don't have access, and that's around 24%. So this is really bad in a way, and we tried to allocate these, show where are these access issues. And as we're going through the story map, you will see how we got to these results. So our first challenge was to actually estimate the population, know where they are living. And to do so, we'll need to get the buildings. Now, some of you might have heard of our Living Atlas deep learning packages. If you didn't, please check them out. These are out-of-the-box deep learning packages that are pre-trained to detect different features from imagery. We've acquired imagery from IOM. That's what you're seeing here. This is drone imagery, and it's pretty high resolution. So our first look was to detect buildings or tents in this case, and the out-of-the-box model didn't really serve the purpose. It's showing that it's actually getting some footprints, which is a good sign, but then we need to retrain a little bit. And what happened is we actually digitized all of this area. So these are hand-drawn, and there are approximately 3,000 polygons. After we digitized this area, we used export training data for deep learning within ArcGIS Pro. It's under the image analyst toolbox. And then we retrained the model. So the Africa model that you'll find on the Living Atlas, we've retrained that with this data in order to come up with a new deep learning package that will guide us around the Rohingya camps. The training process happened on a GPU-empowered machine on Azure, and it took approximately 20 hours to retrain on this data set. Now, the results are pretty good. And for our area of interest, what I'm gonna do is just zoom out a little bit and see the initial model. So the blue is the out-of-the-box model without any retraining, but then after the retraining process happened, we were able to detect all of these buildings or tents. And that's a level of accuracy that's above 85% reported by the model, and that's pretty good to start our workflow. The next step was to get hold of some features in there to classify these tents, and we were able to find a service provided also by IOM that shows the different facilities. These are the points you see on the map, and they're divided over washrooms, latrines, all of them are in the legend. So we've spatially joined this data, and we were able to come with a more detailed land use map or tent use map. This was divided also across the users, and the leftover tents were refugee tents. So there's a lot of estimation, but it gives us a good idea of what's happening in there. The next step was to estimate the population, and there's a figure that says approximately 1 person is living per 8 square meters. Divided that by UNHCR, we divided that by the maps, used some Python within ArcGIS Pro notebooks, and we were able to derive the population counts. You can also see these reflected on each tent that we see out there. The next was, as we labeled the washrooms, we've had the population count estimated, and we know that on average also there's approximately 5 people per household, so we were able to estimate the households that are living within our area of interest. And then we found another figure by UNHCR which says that 7 households per day use 6 square meters of washroom. So doing the math, we were able to get 3.4 thousand washrooms, and almost we have 7,000 households, which means that already we have overpopulated washrooms that don't serve the people. The next area was to study to analyze the flood, and to do so we got an IOM digital elevation model shared on HDX. That was the contours. We generated the digital elevation model, and then we've worked on the flood analysis to create a floodplain that highlighted these tents you see in red. The next step was creating a network data set, which we've used OSM roads with some digitizing to create a network data set, and then use an location allocation tool within ArcGIS Pro to locate these tents and see who lives within and who's got access and who doesn't to the washrooms. All this stuff that I showed today are actually shared publicly within the story map, so you can utilize the deep learning package along with the different model builders that we built for this analysis process. Now I'll hand it back to Olivier, and thank you for attending the GIS Day, and happy GIS Day.
Thank you so much, Rami. What a fantastic mix of technology and spatial analysis there. Really, really nice story. Thank you. Well, that actually closes our speaker list. And so just before handing over to Brendan, who will moderate a quick question and answer session, I did want to close off on the hub itself. I mentioned earlier that you can choose to follow the hub if you want to be notified of any new features or any innovations on the hub itself. To do that, you simply click on that button there, and you'll be presented with this window there. And just wanted to show it to you real quick. You can either use your own account, so you can actually log in if you already have an ArcGIS online account. You click in this; it's not very obvious, but you click on this little link there to sign in using your own ArcGIS online account. And if you don't have an account, you create it right here. Unfortunately, if you actually use this one there, it probably won't accept your login. So you either create a new hub account. Now that's simply creating an account for the hub itself. You're not creating a whole ArcGIS online account or anything like that. It's just really to access the hub, or you can sign in using your own ArcGIS online account. So I just wanted to point that out if you did want to follow. And then, of course, if all else fails, there's a little contact button down there. Don't hesitate to email us with any questions, with any comments, any feedback, especially feedback on the hub itself. This is still a young hub, and we fully expect that we would like to update it and incorporate feedback as it comes in. So please don't hesitate to engage with us on that. So that's that for the tour of the hub. Brendan, I'm going to hand over to you so that we can start facilitating a bit of a Q&A. Thanks very much.
Thanks, Olivier, and thank you to all of our panelists. Those stories were truly inspiring, truly amazing. It's I feel like every GIS day I always get a little bit of a reaffirmation on why I do what I do and where we work and who we work with. So that was great. So with that, the first question we have came in for Qasim from Lebanese Red Cross. Qasim, it's a comment, first a compliment, great system, but then a question. The question is, have you been able to measure the impact of the system that you implemented? So the coronavirus hub, all the technology there was really impressive, but has there been any effort in measuring impact or any indicators that you're looking at that have shown the impact that the technology is, the implementation of the technology system has had on your work? Qasim?
Yes, thank you very much. I mean, to be honest with you, it's still a new initiative. We are not able to measure it yet, but what we can guarantee, since we as a Lebanese Red Cross, we work directly with the community. We are always making sure to work closely with them and coach them to make sure that they are using this information in a best possible way. I will just give quick example. At the last forest fire that we had in Akkar at North Lebanon, we do collect data on the GIS. And then we went through the governor operation room and we make sure and we coach them closely on how to use this information in a best possible way. So the answer, if you keep this information just for the public like this, yes, I mean, you cannot guarantee that it will work in a proper way. By doing capacity building to the community and keep following up and keep doing advocacy, and it's not limited to by making sure you are doing the linkages with the different channels from the DRM at the prime of ministers, going down to the relevant monastery, down to the governorate operation room, down to the community contingency plan. So the bottom up and up bottom approach feeding to each others, we can guarantee that we can do big change, and that it was showing clearly during Beirut blast where we use the technology and it was showing success.
Great, thanks for that, Qasim. Let's move on to our next question. I believe this question is for Rahima from Resilience Mappers. So the question is around access to technology. So we're well aware that nonprofit organizations often have budgetary constraints and that they need to consider in making or procuring technology. So Rahima, how have you worked with that? How are you getting access to Esri technology? And maybe you could remark a little bit about that, how you've gotten access to Esri technology.
Well, thanks, Brendan, for that question. Well, the Africa GeoPortal is basically more of open source. All the tools that are available on there are free. Well, not entirely free, but all the sources that we use for this story were freely available. So you just have to have an account at the Africa GeoPortal, and then you can be able to use all the tools and apps that are available on there. So that is how we manage to use these tools.
Great. So the Africa GeoPortal, if you're not aware of it, that's an initiative that is providing access to GIS technology to essentially the entire continent of Africa. It's listed on the Humanitarian GIS Hub as well. That you can see the link below that Olivier had showed. I'll also note that Esri also provides a number of other programs that provide access to nonprofits as well as to organizations in the event of an emergency. So the first is the nonprofit program, which is a global program that allows nonprofits to procure Esri software for what is essentially an administrative fee. It's about 1% of cost of commercial. So if you're interested in that program, you can Google Esri nonprofit program, and there's an application there As long as you're a qualifying organization, you can get access to that. There's another program called our disaster response program. I'm wondering, Olivier, would you mind giving your inputs on the disaster response program and how that's set up and how you might be able to access technology through it?
Yeah, absolutely. So the DRP, the Disaster Response Program, is set up to provide support for surge capacity requirements. So if you are set up with a particular installation, ArcGIS installation, but you are suddenly faced with a crisis that requires you to rapidly scale up your licenses, then the DRP makes those available for free for a period of 6 months for that crisis period, along with some technical support. So that's what the DRP is about. It's really augmenting for the period of a crisis your ArcGIS capacity. So there, and again, Google that, Esri Disaster Response Program, and it's quite a simple process. There's a form there where you just click on Request Assistance, fill in the form, and then we can then take it with you further.
Great, thanks for that, Olivier. So nonprofit program, disaster response program are two that our Esri manages. Also, the Africa Geo Portal as well, if you happen to be operational in Africa. We have another question for Rami around the work that you did with the deep learning analysis for the Rohingya settlements in Bangladesh. The question is around the analysis, publishing the analysis. So is this so the question is actually around other agencies that are using the analysis, but maybe in your response you could also remark on the analysis itself and where one might be able to find those models and apply them to their own work. Rami?
Cool. So the models I mentioned first, there's like around 20 different deep learning packages that are available within Living Atlas. So if you go to Living Atlas and you just type in the search DLPK, you should see all these different deep learning packages. Now, the model that I worked with in this story map, because I used the one that is available in Living Atlas, which is Africa Buildings model, I retrained that building, that model, and this is also available in the resources of this story map. So I believe there will be some resources sent later where you can find this story map. It's publicly available. If you type on Google a Rohingya refugee camp analysis, you should be able to locate this story map and get to the resources down there. Now, one more small thing, deep learning is very tricky when it comes to different landscapes that you're working with, and the change of landscape will certainly not give you the same results as models working in different areas. So most of the time, if you're working on if you trained a model, let's say somewhere in East Asia, and you want to use it in West Asia, you will have to retrain a little bit. So keep that in mind.
Great, thanks, Rami. Just a really quick follow-up question about the imagery. I understand it's drone imagery. Is that available for other NGOs, or maybe we should direct you to IOM, who's the
Yes, the image services are publicly available by IOM. So if you type refugee camps Rohingya, something like that, IOM, you will find an ArcGIS web application that got all the images out there, and there's images from different places.
We have a question for Nadia from Social Worker Syndicate in Lebanon. So the question is, Nadia, being new to GIS technology, geospatial technology, how have you seen these new tools, surveys, dashboards, etc., impact your overall operations? What's been the impact of these tools on your operations?
Yeah. I'm laughing because yes, it was very new, and it was not only new for us as social worker board members, but also for the members themselves. And because we were like working in emergency, we were focusing on other kind of interventions, on our questions, what to do, how to refer people, etc. So we were involved in the implementation. So when it comes to technology, it takes time for us to learn how to use it, but it is simple. So if we can when we were like trained by the team on how to use it, it becomes like simple for us. And this gave us like more visibility because we could show our work, the data that we collected, the people that we reached out from all over Lebanon. So this was possible within this technology. And also when we will be using it, and for example, to build our platform, the social worker members, volunteers, old members, etc., it will show also the ID of the syndicate and where are the members, how many they are, what are their profile, where they work, where they are located in Lebanon, in which intervention they are doing their job. So this also it gives us like more also visibility, and we can have like a platform when we are collecting data and showing it for other stakeholders. So this will help us to play or to show that we are a key player on national level, especially because we started with Esri in the emergency. We are a key player during emergency. So
that's
yeah.
great. Yeah, that's great.
Thank you.
No, thanks for that input, Nadia. That's excellent to hear it's transformed. So we're running out of time here. I do want to pose a question to Erica, though, from the Harvard Humanitarian Initiative. The question is, what would you say is our next step here in fostering this science of humanitarian GIS? You know, where do we start?
Oh, that is a good question. Thanks for that,
You got
Brendan.
2 minutes to answer it.
All right, well, let's start off with, I think, centering impact is incredibly important for building humanitarian geoanalytics and really building out our objectives and questions first, as opposed to going from technology and data-centric practices down. So I think that that's the most important part of building this up in the right way, in a way that kind of repivots us from like that tech-centric top-down method that a lot of academia likes to employ. So for me, it's really a call to community, it's a call to collaborators, and it's a call to the rest of the GIS community to really start with that end user and center that end user's experience, challenges, and data.
That's amazing, and I couldn't agree with you more. I think it's you know, working at a technology company, so much of it hinges on the questions you're trying to answer and the people who are involved in the processes. So I love that we ended on that note. So thank you, Erica, and thank you to all of our panelists. This has been, you know, one of the best webinars that we've had for GIS Day. I was really inspired by all of your stories, excited about the technology applications, and I'm excited to see what our community will do in the coming year, leading up to the next GIS Day. So with that, thanks again, once again, to everyone for taking some time out of your day, and happy GIS Day.